Governor Tim Walz thanked the Minnesota National Guard who are helping long-term care facilities with staffing. But Walz and other state leaders warn the demand for testing amid a fast-spreading Omicron variant will continue to surge. Carolyn Cummings reports on the latest efforts to make more available.
Long lines and frustration and the hunt for COVID tests is familiar to many Minnesotans recently. But state officials say the soaring demand is going nowhere fast.
We come into this with more capacity to adjust and to flex than most states. But in all candor, I think, things are going to be tight for a few weeks.
Health Commissioner Jan Malcolm and Governor Tim Walz vow that they're doing everything they can to meet the demand. But demand is unprecedented. The governor says there's more need now than at any other point in the pandemic. And the worst of the case surge isn't even here yet, with predictions that a peak could hit by the end of January or early February.
What we're seeing in other states, other cities, other countries is the speed with which the growth curve literally goes vertical.
Today, the governor announced new steps to expand testing capacity, including 3 new state testing sites, 1.8 million rapid tests for schools, and even more rapid tests in partnerships with organizations to reach diverse communities.
And there are going to be times with the number of tests we're giving is an all-time high. There are going to be some of the delays, but we're making structural changes.
There are still 14 National Guard missions underway to relieve staffing issues at long-term care facilities like this one. And Commissioner Malcolm says that the state is still awaiting official guidance from the CDC about the latest quarantine rules. In Maplewood, Caroline Cummings, WCCO 4 News.
Governor Walz says the new state testing sites should be up and running next week. Now, for nearly 2 years, we've been hearing how important it is to mask up. But with the new rapidly spreading Omicron variant, experts now say cloth masks don't cut it anymore.
The typical cloth mask might be 50% effective, and that was okay before. It doesn't seem to be enough with Omicron. We have special masks called respirators, such as an N95, that offer much greater protection. They're able to block 95% of particles that are either going out of your mouth or that you're breathing in.
Meanwhile, health officials are seeing more examples of people catching COVID-19 and the flu at the same time. A so-called flu-rona. Rare examples have happened before, but it's becoming more common with COVID cases on the rise. Health officials are still working to find out how often a co-infection can happen. CDC officials say there's no clear evidence that getting both causes more hospitalizations than COVID by itself, but they encourage people to get vaccinated to help protect from that possibility. The physical impact of COVID has devastated hundreds of thousands of people in the U.S., but there's also been a more subtle impact, mental health, and it's been showing up in kids as they navigate their way back to in-person learning.
They are feeling increased anxiety around just how to be and communicate with people and build friendships and being able to feel comfortable in their environment.
One global study found that symptoms of youth depression and anxiety have doubled. Experts suggest parents remember that if your children seem immature for their age, there's a reason they missed out on more than a year of development with their peers. And be patient with your child as they transition from one way of life to another.